was created. And it has moved from its small beginnings to becoming one of the largest healthcare companies in the world. Now, it has achieved this growth through correctly analyzing and overcoming various challenges through the years. But today, it's facing new challenges in the Hospital Automation Solutions division. Now, we are going to offer our recommendations on what to do with these challenges. So I'm Louise, these are my colleagues Julian, Rafael and Eric, and we are from Solvay Presentation. We are creative. So, when we started doing our research, we looked at the core values of McKesson, and we identified 3 core values. Now, these are cost effectiveness. These are offering quality solutions and safety for all patients. Now, it's in this QCS framework that we wanted to offer our solutions. So, hospital automation solutions have already answered a few challenges. We know that medication errors exist, they are frequent. We know that healthcare costs are quite high. And we know that in hospitals, people aren't always using their time and resources as efficiently as they could. Enter hospital automation solutions, and they have been able to reduce costs, reduce errors, reduce human errors, and optimize the use of time and resources in hospitals. But today we have some new challenges. The government, who is buying our machines, has to slash its budgets when it comes to healthcare. We also know that Canadians don't feel involved enough in their healthcare. Now, only 25% of Canadians have a general practitioner. Now, in Belgium, it's about 95%. So this is definitely something that stuck in our minds when we came up with our solutions. And finally, we do know that healthcare is lagging behind other sectors when it comes to using technology. So what are our solutions? First of all, we want to expand into nursing homes and correctional facilities with our PatMeds machines. We also want to achieve double-digit growth, that's 13% by 2017, by going online and offering everyone a healthcare card. So this healthcare card will be linked to an online platform and software that we are going to develop using our high accessibility server and partnering with HP, who already offers this kind of software to creators. So now I'm going to leave the floor to Julian, who's going to explain a bit more about the sectors we're going to enter.
Thank you, Louise. So now let's talk about this expansion activity. And first, let me begin with the nursing homes. As you can see on this graph, the aging population is a major issue in Canada. The older population is growing fast. This will increase healthcare costs, and this is a problem we need to address. Secondly, you can see that 66% of the total amount spent in nursing homes is used for salaries. So that's why we need to think about cost-effective decisions, and why not about time efficiency of the nurses in the nursing home. Then it's important to remind that the first McKesson's client is the government. That's why we need to see that 73% of nursing homes facilities are funded by public sources. That's why it's an opportunity for us. Then we need to think about what product we need to sell. And we strongly believe that packaging is the best solution. Why? Because it offers lots of benefits. First, it reduces all solid packaging labor by 65%. Then, it also can reduce human mistakes and improve inventory levels. So we really think those advantages can help to tackle different issues in the long-term facilities. But what we thought about nursing homes, let me just tell you this. When we talk about it, I personally remembered that when I was 16, I helped people in a nursing home. And I remember that one day, a nurse a nurse made a mistake when she was distributing medicines to a patient. Fortunately, it didn't harm anyone. But this even shows that human mistakes are possible. And thanks to ophthalmic solutions, we can reduce those mistakes in nursing homes. Secondly, the correctional facilities are also good opportunities. Because what we found is that the cost of managing healthcare has risen by 50% over the past 10 years. So we know that we can do something about that. Just quickly to give you this, for the nursing homes, we did an analysis to find out what would be the best provinces in order to focus on. And because of the criteria that we've chosen, we can see that 4 provinces in Canada would be well interesting to focus on. British Columbia, Ontario, Nova Scotia, and New Brunswick. So those provinces offer the most opportunities in terms of nursing homes. But what would be the strategy? And this is simple: bundling. We want to bundle pharmaceutical drugs and one of our machine pack-made packages. We know that McKesson is already selling drugs to nursing homes and pharmacies. But what they need to say is, okay, you need drugs, but you also need our technology in order to reduce your cost. By bundling these 2 products together, it will be really profitable for us and will be the best opportunity that we can do. It's a success story because in the past, McKesson has already done that bundling strategy, and thanks to it, it increased its market share. So we're convinced that the bundling strategy is the right solution for us. Finally, we want to keep in mind the QCS framework for our strategy. First, thanks to the PECMET machine, the nurses will have more time to focus on patient-centered activities, which will increase the quality of the services, of course. Secondly, we computed that the cost can be reduced by 35 Canadian dollars per day per nurse in average. So cost effectiveness will be there. And finally, thanks to the technology of McKesson, we can reduce the human mistakes, and we want to really focus on the safety of the patients in nursing homes. Now, my colleague will talk to you more about the correctional facilities.
Thank you. I'm going to tell you why we believe McKesson should enter a correctional facilities. So first of all, cost of keeping inmates and incarceration rate have increased so far in Canada. On top of this, a survey has been conducted among these inmates, and it shows that many of them suffer from diseases but have very poor access to healthcare. In fact, the most common complaint is healthcare. And finally, the total amount of money spent by the government for healthcare for correctional facilities amounted to $218 million in 2012. So all these facts combined clearly show there is an opportunity to enter this market. But where precisely? Well, you can see on this graph the number of inmates per 100,000 adult population. Clearly, Alberta, Saskatchewan, Manitoba, and PEI report highest incarceration rates among provinces. Therefore, we believe that McKesson should first address these markets. Now, we would also like to implement our correctional facility strategy within a QCS framework. First of all, increase the personal satisfaction thanks to quality solutions and products. We would also like to reduce the errors that are made both in packaging and labeling. And finally, and most important of all, in the long run, the use of pack-made packages will decrease the total amount of money spent by the government for healthcare for correctional facilities. Now, this picture is a real doctor prescription, I promise. Now, I have a question for you. Who in this room is able to read this? Please raise your hand.
883-10532.
Well done, well done, well done. Okay, so either we have superpower, like our colleague, or we're like most of the people, and we have difficulties reading this. Unfortunately for us, 80% of clinicians still use paper to make very important decisions that affect all our lives. On top of that, more than 75% of all patients all agree on increase the use of digital service for their healthcare in the long run. And all these people come from all age groups. And finally, but most important of all, I really would like to emphasize on this, is that Canadians are the world's most intensive internet users, but yet there is no clear solution for their healthcare. This is why my team and I figured out a very simple solution that McKesson could implement to fix this problem. This very user-friendly card is the solution to make each one of you more concerned about your healthcare. So assume I would like to get one of these. What should I do? Well, first, either go to a pharmacy or an hospital and ask for this card. There, I will be asked to provide very basic information about myself that will be stored on a chip. On top of this, I will be asked if I want an automatic payment system for my prescription. Following this, I will be informed by email of a renewal of the prescription, and also informed by email when my drugs will be delivered. The only thing I need to do there is pick up my drugs at a McKesson's banner pharmacy. And finally, all these data will be collected and stored online, where I can access them all the time, and every doctor also. Now, I'll leave the floor to Eric, that will tell you more about this software.
Thank you, Ed. So actually, how can McKesson benefit from these electronic healthcare cards, and more generally from the IT sector? Well, we saw that McKesson already has an existing database that saves and backs up all the patient's data. This is called the Higher Availability Server. It also provides a continuous data protection. But the most interesting thing of the database is that all these data are updated in real time. So we strongly believe that McKesson should use this database and combine it with a software that will be developed in order to manage all this data. For example, HP has an existing relation with McKesson Corporation, and it provides such services. So this could be the perfect solution. So by doing so, McKesson will sell a service to hospitals managing online patients' profile, which will be updated in real times. For example, take an average Joe with an EHC, so an electronic healthcare card. This guy has a prescription, goes to the pharmacy, asks for his drugs, and all this will be automatically updated on his online profile, and the hospital will know that this patient will stick to his treatment and follow his prescription. So now, this solution will provide opportunities for both McKesson, hospitals, and patients. If we take the example of the average Joe once again, thanks to his EHC, he won't stop his prescription after 6 months, thanks to, for example, Reminders Studio. And he will have an active role in monitoring his health, thanks to, for example, disease surveillance on his online profile. So as a result, he won't be anymore among the bed workers in emergency rooms, and the government won't pay anymore for these kind of guys. So this leads to 3 main things. The first one is, if the government doesn't pay anymore for these guys, this means it will be possible to reallocate its budget to other sectors, for example, in hospital automation solutions sold by McKesson. The second thing is that it will increase the hospital pharmacist time in patient-centered activities. And finally, above all, it could push sales of McKesson generic drugs, because a patient on his online profile could order directly generic drugs from McKesson. And more drugs will be sold through the banners, pharmacies of McKesson.
So now, obviously, this strategy implementation will be within the QCS framework, so the quality, cost effectiveness, and safety. Even if it's a brand new sector, we have to keep in mind core values of the company. Quality by increasing client satisfaction and enhancing patient care. Cost effectiveness by reducing staff workload. And finally, safety by reducing errors caused by misunderstanding of doctors' prescriptions. So now, if we move to financials, we can see that this strategy will grow the revenue by more than 20 million Canadian dollars over the 3 next years. Compared to the forecast revenue of the coming years, this represents a double-digit revenue growth of 13%. We also see that this project has a positive net present value of more than 500,000 Canadian dollars. The first year, we will have a big investment of 2.5 million Canadian dollars, which includes, for example, the development of the software. But, as you can see, the payback period is only 2 years. I will now leave the floor to Louise, who will finish this presentation.
So if we look at the timeline, we want to implement these recommendations over 3 years. So for nursing homes, in 2015, we want to be at the end of the year in New Brunswick and in British Columbia. In the next year, we're going to move on to Ontario and Nova Scotia. Now, if we look at correctional facilities, we're going to start with Saskatchewan, and I apologize for my pronunciation, and Manitoba. Next year, we're going to move on to Alberta and Prince Edward Island. Now, we believe that moving in nursing homes and correctional facilities will enhance our relationship with the government and positively impact the HAS division, since we will be selling more machines. Now, for the electronic healthcare records. In 2015, the new people coming into hospitals will get a healthcare card and will be asked to fill in their information. There will also be reminders for prescriptions, so you will get an email to come and get your prescription in about 6 months, in about a month, etc. In 2016, we want to start the online platform. So not only will you get reminders by email on when to get your prescriptions, but you can actually see a list of all of your medication, of your past visits to the hospital, of when you went to the pharmacy, etc. And in 2017, we want to launch a mobile application. Now, we all use applications, I'm sure, and this is to target younger people. So emails are great for baby boomers who are getting older, but we do want to reach a younger segment, and this can be done through a mobile app. So, to sum up, we want to expand into nursing homes and correctional facilities through our PEPMED machines, and we want to innovate through our healthcare cards and through the development of an online platform. So I'm going to thank you for your attention and open the floor to questions.
So I like the idea of the different operating segments, and it's actually sounds very interesting. The question I had was, with regard to the $35 per day per nurse, how do you come up with that?
So that was
I would say somewhat early on. Oh, slide number 10.
Thank you very much. Slide number 10.
So we saw that in the appendix we have 65, the package will reduce of 65% of the labor time of a nurse.
And we did the calculation.
Really, since the
Just
appendix
time missing.
No, the appendix. So, well, we did the simple calculation, but I will just have figures it to be much simpler, easier.
Okay, maybe I can explain this one. What we did basically is we looked at the time that a nurse takes per day to bundle medications to distribute them. Then we figured out that PacMed could actually cut 60% of that time. And then we looked at the cost hourly wage of a nurse on average, and so that saved us $35 per day. That was our calculation basis. Yes?
First of all, I like very much the QCS approach to looking at the problem. It's a nice little interesting module. My question is really around the electronic health records. If I understand correctly, one of the big thrusts of your suggestions is to have a health card, smart card, that is going to contain all of that EHR type of data. Have you looked at what's going on currently in Canada with regards to that? How much penetration has been in the market with regards to electronic records? And what are your thoughts on that versus what's already been happening, what's been successful?
So we did look at what's happening right now, and we do know that the Canadian government has wasted a lot of money trying to get into electronic healthcare records. Ontario last year spent $1 billion on that kind of project, and it didn't work. And why isn't it working? Well, right now they're going too big. They're thinking electronic healthcare records, we need to give a card to everyone, we need to go everywhere at the same time. But what we want to do in our approach is, we know that 1% of Ontario's patients, this is an example with Ontario, consume 34% of healthcare spending. So what we want to do is not waste our money on trying to reach everyone, trying to give a card to everyone at once. What we want to do is focus on this 1% that actually spends for 34%. And once this strategy has worked, we can branch out into other people and distributing healthcare cards to other segments.
Thank you.
Yes.
On a similar note, based on what's happening currently, but if you're thinking about kind of a holistic understanding of a patient and what prescriptions they have you thought about the existing cards that they might carry in their wallet today, be it a Medicare card, a health insurance card, and certain kind of private data that's being captured? And how do you kind of integrate all of that?
So obviously everyone's going to be on different healthcare solutions, so that is something that needs to be taken into account. However, we feel that our card really brings all of this together. We're not only touching hospitals, we also want to bring in the pharmacies, and we also want to bring in their plans, because once you upload your information, you can absolutely say, I am on this plan, the government is giving me this, etc., my business is giving me this kind of plan. So really what we want to do with our card is just centralize all of this into one card. Yes?
Well, thanks for the market research. I think it's interesting that you've positioned it towards nursing home and correctional facilities. I'm curious to know why you focus, I won't say exclusively, but mostly on one automation solution that McKesson offers, as there's a lot of other components in the automation offering.
I'll answer this question. So obviously McKesson has a lot of different products in this division, but we chose PacMed because we found out that for long-term facilities, this was the most useful because it's really for all solid medications. So this is the most medication that is needed in nursing homes in one side, and in correction facilities. So oral solid medication, this is the first thing. And especially because with the SE model, they really can try to have a high production level. So like in one day, they really can improve the time efficiency of the nurses, and it really can help the communication between the nurses. And of course, if they spend less time packaging all the medicines, they can be more focused on the centered patient activities.
Okay, thank you.
What steps do we take for older patients. So currently, it's an older demographic, so of patients, we have an aging population. So there's I think the emphasis, I agree 100% on trying to continue to automate things and get everything online. How do we transition those currently older patients, so an 80-year-old who doesn't have a cell phone and can't use a mobile app necessarily, or one of these scenarios?
Now, we were right about that. Obviously, older people have a harder time going online. But then we saw a report actually that said that older people do want to get online actually. Now, we're talking about different kind of online solutions for different kind of age segments. So obviously we're not going to launch an app for 80-year-olds. I think that wouldn't work. But we did find that people aged 40 plus are actually very interested in receiving emails and are having trouble filling in their prescriptions, and an email service could greatly help them. So if we look at, I would say segments 40 plus, we will be more active in sending them emails, etc. But in the younger segments, that's where we're going to launch the mobile application and do something a little bit more tech savvy.
We have time for 2 more questions. If there's any.
And just to clarify, I think a previous judge from McKesson talked about the whole offering of the hospital automation solutions, and you've definitely picked out a few which represent growth. So are you suggesting for the remainder of the offering, which currently specializes in hospitals, are you suggesting they exit that, or?
I'm sorry, I'm not sure I understand you.
Right now, there's a whole suite of solutions in the hospital automation segment, and you're suggesting growth in specific in products. So currently they operate in the hospital environment. So are you suggesting that they exit that segment and they focus? Just wanted to clarify that in terms of your overall strategy. Is it a phased approach?
So
and
no,
moving towards your growth markets?
So no, we aren't going to be leaving the hospital. Hospitals, obviously, they represent a huge part of the hospital automation systems. What we are going to do, strategy-wise, was in the first year to implement our solution, we're going to offer our software to a few of our hospitals. And once they do get into the software, they can completely use it with the other machines that they have. We were talking about further in the future, 2020, we could take this card and actually put it in the machine, and the medication comes out directly. So we believe that it is complementary with our presence in hospitals right now, and that any doctor that is in the hospital can directly go online and see, okay, this patient just arrived, we know that he has these kind of problems, etc.
Great. So I'd like to thank very much.
Can I just make one real quick point?
Yes.
I think at the beginning of your presentation, you mentioned that only 25% of Canadians have a primary care doctor. You might want to check that math. I think what it is 25% of Quebecers do not, 75% do, and across Canada, it's mid-teens that do not.
I think it's 15 in Canada and 25.
That do not.
That you know, actually that was in,
Okay, yeah, because I think you said that only 25% did.
Sorry,
Just watch that for the
yeah,
next
no,
one.
you're completely right, it's 35%, yes.
Thank you very much, Solvay.
Thank you.
Thank you.
Thank you.